today's video is going to be a little different. And it's different because this time we're going to be discussing some of the underlying biomechanics of a street fight that recently went viral. Before we get started, there were political undertones to this interaction. That being said, I don't care about any of your political opinions, being that this isn't a political video. So let's start with what I'm calling slap number one. Alright, so slap number one. Slap number one is coming from the guy with the glasses and is being delivered to the guy in the Doge shirt. Okay, and so the main thing I want to take away from this is just looking at what's happening at the shoulder. Okay, so we're getting a nice triplanar movement, meaning it's hitting all three planes of movement of the shoulder. So we have shoulder flexion with muscles like the anterior delt and some of the upper fibers of the pec major, maybe coracobrachialis, some of those smaller muscles. We have shoulder abduction along with some scapular elevation with muscles like the middle delt. And then we have external rotation with muscles like the infra and supraspinatus in the rotator cuff, and also the posterior delt helps with that external rotation as well. So as he's doing this, he's flexing, abducting, and externally rotating his shoulder with his elbow slightly bent in flexion, and he makes contact with the upper cheekbone and then kind of does a little bit of wrist extension with, I guess, what you would call a follow through there. But that is the main movement that we're seeing here at the shoulder with slap number one. All right, slap number two this time is being delivered from the guy in the Doge shirt to the guy wearing the sunglasses. Okay, so after a little bit of deliberation here, you could tell he was kind of figuring out whether he wanted to do it or not. But let's start here because he actually does a pretty good job of moving his shoulders and using his trunk. Okay, so you can look at the plane of the shoulders. If you were to draw a line from shoulder to shoulder, you can see that he actually, to start the movement, he doesn't really wind up. He just kind of starts with trunk movement. So trunk rotation happening mostly at the thoracolumbar spine with muscles like the internal and external obliques on either side. And then you have big muscles like the multifidus that contribute to rotation as well. So while that's happening, this main movement is happening at the shoulder. Okay, so he's doing a combination of three movements again. Shoulder flexion, again with muscles like the anterior delt and the coracobrachialis, some of the biceps as well, and then the upper fibers of the pec major. We have horizontal adduction. What we see if we see somebody throw like a hook, that would be bringing the arm across the body. Again, with muscles like the pec major, the full fibers of the pec major this time, the sternal, the clavicular, and the costal fibers. And then you have internal rotation or medial rotation, which is happening from one of the muscles in the rotator cuff called the subscapularis. And we also have the anterior delt and the pec major, again, helping with that as well. Okay, so nice triplanar movement. He's got a little bit more force behind it because he's using his trunk. And again, a really nice isometric contraction here of the muscles of the forearm, some of which cross and go into the fingers that creates a nice kind of weapon to use there. Okay, a little bit of a follow through. Guy's glasses get shoved off. But that triplanar movement and along with the kind of the use of the trunk to generate a little bit more force is what I want you to take away from slap number two. All right, part number three is the takedown. Okay, so we've got a nice little hip throw here. So the main thing I want you to take away from this is his trunk movement. Okay, and for those of you who don't think training in the gi matters, I'm a no-gi guy myself, but got credit where credit is due. You guys got a hoodie on. He's got a nice sleeve grip, and he's got a grip on the back of his hoodie there, okay, for leverage. So train in the gi, don't train in the gi, who cares, but it actually paid off here, okay? So let's look at his trunk. So what he's doing with his trunk as he steps to try to create that leverage for the throw, he's flexing the trunk. Again, this is another triplanar movement, really good use of body control here. So he's flexing the trunk with muscles like the rectus abdominis, and some of the obliques help with flexion as well. He's side bending to the left, right there. He also rotates to the left. So we've got flexion in the sagittal plane, side bending to the left with muscles like the internal and external obliques for that side bending movement, also the QL and some of the lat as well. And then you have rotation mainly happening with the obliques. And like we talked about earlier in the posterior chain, some of the multifidus and other muscles that help, those big muscles of the erector spinae that help rotate, okay? So he's using a lot of good trunk control here, and then he's got some pretty good leverage. You know, obviously could have been better, but, you know, nothing happens the way you want it to in a street fight. But that's what I want you to take away from number three, which is the takedown. All right, and part number four actually happens pretty quickly after the takedown. Okay, so the guy kind of off balances him, and to the untrained eye, it looks like he's going in to try and mother milk himself. But this is not what's happening. Obviously, he's trying to bite this guy. Okay, so this requires the muscles of mastication like the temporalis and the masseter. Okay, so these muscles are heavily involved in biting. This is a street fight. We know that everything goes, and as the people try to help, you can tell that his face kind of changes there because hopefully his nipple's not being bitten, but his chest is definitely being bitten. But those muscles of mastication are muscles that we don't typically go over on this channel, so I wanted to show you guys what was happening there. So that's what I want you to take away from number 4. Muscles of mastication are not off the table when it comes to street fights. And number 5 is the triangle. Okay, so really good view of hip mobility and really a poor base from the guy that's getting triangled. But so he's flexing. So take a look at his right leg here. He's flexing the right hip with muscles like the psoas, the TFL, the rectus femoris, among others. He's also externally rotating his hip. So at this angle, you've got muscles like really the glute max that help externally rotate the hip. And then you have knee flexion for that bite on the left carotid artery. So the carotid, for chokes to happen, we need to have that downward pressure, which he's applying with his left hand. We got to have one carotid artery be occluded, and then the other carotid artery be occluded for a really good choke. Okay, so he's flexing his knee to get that good bite on the left carotid artery. Okay, and then another thing that we haven't talked about necessarily about the triangle is this ankle is plantar flexing to help create that cinch as he flexes the other knee. Okay, so the only thing that might need to happen here a little bit differently is his arm is out under, almost as if to get an underhook, although I don't know if this guy really knows what he's doing. He might need to get that shoulder out and about, but his main goal here is really just to hold the guy down and not, seemingly, and not actually choke him out. But really good view of the mechanics of a triangle as it's happening in a street fight, and that's the main takeaway, along with the fact that just don't fuck with people in the street, especially if you don't know what you're doing. Take your hands, put them kind of up in front of you on your face, or put them somewhere that can protect you, and use your words. Okay. Thank you guys for watching. Let me know if this was a little bit different, so let me know if you enjoyed it, and I'll see you next time.